Welcome to this video. I am Dr. Malak Tamasgen. Now I will show you sample medical histories that can be used as a template for history writing. Identification: name, Ato M.A., age 60 years old, sex male, address Gurage, occupation farmer, marital status married, religion Muslim, date of admission March 14, 2016 Ethiopian calendar, date of clerking March 22, 2016 Ethiopian calendar. When you present your history for bedside or round session, you should present in a sentence form like, this is Ato M.A., a 60 years old married farmer from Gurage. He was admitted on March 14 and clerked on March 22. Previous admission mentioned in the HPI. Chief complaint: worsening of shortness of breath of 1 month duration. History of present illness. This is a 60 years old male patient who is a non-cardiac patient for the past 3 years on a regular follow-up at Tukur Anbessa Specialized Hospital every 2 months and taking a white circular tablet taken once daily. His presentations while he was diagnosed were shortness of breath, non-radiating substernal chest pain, and dry cough. After certain investigations and imaging, he was told that he has cardiac problem. When his symptoms were relatively subsided, he didn't come to the appointment and discontinued his medication. A month back, he presented with a gradual onset of shortness of breath on exertion that progressed to ochre at rest. He usually woke up hunger of air at night and used 2 pillows while sleeping. 2 weeks back, he started to experience a gradual onset of dry cough, which later became worse and productive of whitish, non-foul smelling, non-blood tingled sputum of 1 coffee cup per day. Associated with this, he has bilateral ankle swelling, easy fatigability, loss of appetite, significant but unquantified weight loss, drenching night sweats, and low-grade intermittent fever. Otherwise, he has no history of chills, rigor, and skin rash, no history of joint pain or swelling, abnormal body movement, no history of dental extraction or procedures, no history of intravenous drug use or tattooing, no history of swelling on the neck, heat or cold intolerance, no history of smoking and alcohol drinking, no history of hypertension, DM, and asthma, no history of chest pain, wheezing, and contact with chronic cough or TB patient, no history of yellowish discoloration of the eyes and skin, no history of blurring of vision, lightheadedness, and tinnitus. Past medical history: 4 years back, he had diffuse and itch exfoliating lesions on the trunk and lower limbs which have no discharge. He was given a topical cream at Alert Hospital and healed with hypopigmentation. Personal history: he was born and raised in Gurage, where he lived all his life. He grew up in a family who were farmers and he became a farmer at a young age. He never went to school. He is married and has 5 children. He lives with his wife and children in a house that has 2 parts and 3 functional windows. They have separate houses for kitchen, for cattle, and toilet, and they use a pump water. Family history: both his father and mother died of unknown diseases at old age. He has 2 brothers and 2 sisters who are alive and healthy. There is no family history of similar disease and sudden death in the family. There is no family history of hypertension, diabetes mellitus, asthma, and allergy. Functional inquiry: HNT, head, no headache and trauma; ear, no hearing impairment, earache and discharge; eye, no visual impairment, redness and photophobia; nose, no epistaxis, discharge and sinusitis; throat, no sore throat and ulceration; lympho-glandular system, no lymphadenopathy on accessible areas; respiratory system, it was mentioned in the HPI; cardiovascular system, it was mentioned in the HPI; gastrointestinal system, no history of vomiting, diarrhea, constipation, and abdominal pain; genitourinary system, no history of reduced urine output, reduced discoloration of urine, frequency, urgency, and dysuria; integumentary system, it was mentioned in the HPI; musculoskeletal system, no deformity and limping; central nervous system, no loss of consciousness and weakness. After writing your history, you will write your physical examination. If you have any questions and suggestions, please write in the comment section. Thank you.